This is great. So I think this will kind of open up our question period. I wanted to to offer just an extension to Anne's time there, just to ask about some of the barriers in your view to further innovation in the space of long-term care support.
Sure. So I will say a few things. First, so there are, as I was saying before, there are a wide variety of entrepreneurs right now who are out. I mean, people who really care about this space, who dearly want to be able to support families and their caregivers around navigational challenges in long-term care. And there are, I think, two barriers. One is, well, three. One is that, and this is the one that I think it, you all can address in your work, which is that the need for information in navigating the healthcare system is often not connected to the need for information in the long-term care system. These are both separate. They're separate systems, and we are working very hard in health system delivery reform to integrate them. We need to integrate the information. So that's one thing. The other thing is that we don't have a financing system for long-term care. So people are very worried about money, and it's hard for consumers to decide, hey, I'm willing to pay out of my own pocket for some tool or, service or a geriatric care manager or, a paid private care manager when they don't even know how to value that. They don't understand you don't know what you don't know. So how can you put a value on information? Like, I can pay for college counseling for my daughter. I know what that is. But I don't, it's hard for me to pay for somebody to help me find assisted living because I don't even realize that there's a need there or that I could screw it up. And you can definitely really screw that up. So, So I think that, and then finally, the last thing I would just say is often what you need isn't what you want in this area of elder care, parental care in particular. There's a lot of conflict in families and among siblings and parents and children and among medical professionals and families about what is actually the best course of treatment or care. So it's really complicated.
Mm-hmm. Great. So I wanted to ask a question of Lisa also, but and then I think we'll open it up to others. So a question for you about just thinking about manufacturers and you touched on this a bit, but as far as like what would make what would make it attractive to manufacturers? Maybe you've already discovered some of this as far as that would incentivize in a way or make them more apt to want to redesign some of these products to be more accessible to older adults.
Thank you, Deidra. I think that it's really a matter of taking a different perspective on it so that it's not how can we be more profitable as a company, but how can we help more people in achieving their health goals, and to see it as to see older adults as a population that's really valuable to reach, and that they will enjoy, that they'll use the devices, that they'll benefit from the devices. And I think that it's really considered, even with the growing demographics of this age group, I think that a lot of people just don't see that the profitability, see that as advantageous to their business model.
Mm-hmm. Great. So maybe I'll go to some of the roundtable members. So I see Chris.
Hi, Ann. This is Chris Trudeau. I'm from the University of Arkansas for Medical Sciences, and I'm also a law professor there too. But I was really excited to hear that you're kind of mentioning the need for legal services. I think that's such a there's a crossover with the medical side of things and the social side of things and the legal side of things, particularly for the older adults and the older population. So I'm wondering, just from your experience, two-part question, but one is kind of just your experience on what were the general types of legal needs that you've seen most often in daughterhood, and kind of, and then the second question is how, and this is probably more difficult, but your thoughts on how do we design a long-term care delivery system that integrates the legal side and the social side with the medical side. I mean, what's your thoughts on how best to do that?
Wow. Well, so I'll answer the first question first, which is just I think so the greatest challenge that I hear about is confusion over roles among siblings, and money ends up becoming an issue. But but really, who's in charge and how much sort of control does that person have versus the other person, and then maybe kind of secondarily. My sister is doing all the work and she thinks now she deserves to be paid. And I don't think she does. Or the verse, it's one or the other. Either my sister's doing everything and she won't let me do anything and now she wants to be paid, or my sister won't do anything and I'm doing everything and then she tries to tell me what to do. So it's a kind of needing somebody with a legal framework and really a social framework to help that family function as a system in caring for this older adult is what is needed. And as far as integrating legal, I don't know the answer to that question. I mean, I think that, again, it comes back to kind of the role of whether it's the long-term care providers or the medical providers sort of recognizing and identifying these needs as they arise in the context of their practice. So, I'm interacting with this one member of the family. I know there's this issue, and just knowing what the resources are and being able to refer people.
Other question? Sure. Stephen.
Hi, Stephen, University of Maryland. So you get this listing back of 300 some different facilities. I mean, I need a plumber. I don't go to the Yellow Pages. I need a roofer. I don't go to the Yellow Pages. I go to Angie's List. Yeah. So why is there no equivalent of Angie's List? Whether the area agencies can say, we're going to do an Angie's List. I pay a prescription for that. Mm-hmm. Mm-hmm. So why is it so hard?
You are one of many, many people who's asked that question, and I was one of them several years ago. So thank you for that. It was a great, great question. So I think there are several reasons why so first of all, there is sort of an Angie's List. It's called caring.com, and people don't want to subscribe just for this. So in other words, you can't build a consumer base. You can't build enough subscription revenue just on this issue alone. So it has to actually, so in the case of caring.com, it's basically paid for by the facilities who advertise, and they get higher placement if they pay more. So you see that it's not a true sort of consumer tool. And so really people do use, in fact, Angie's List or others for these types of services. But what they tell me is, I don't want to leave a review because I'm worried about what the ramifications would be for my family member. These care providers have a lot of control. So I think it's kind of, there's a business model, there's a sort of an audience and business model challenge, and then there's sort of this platform may not be the best one. Part of what we're trying to do with Daughterhood Circles is create those friend groups, that exist in communities so people can get those word of mouth referrals, because that's how I get my plumber. It's from my neighbor.
Great. There's a question over there. I can't see your
Hi.
placard there.
Jay Duig, member of the Roundtable and with AbbVie Patient Safety. Dr. Galtieri, thank you very much for the presentation. In particular, what struck me was how you framed it, tying it to the long-term patient safety, the idea of the chasm, of having the chasm that exists between having a device and successful uptake and successful use of the device. I think that's something we've seen consistently around health literacy and other engagement initiatives. I mean, it's the same principles that can potentially speak towards being involved in the community, or like that initiatives where you have transportation. It's our recognition and understanding that there's more happening than from a public health perspective than if you build it, they will come. That if you just give them phones, then all of a sudden that's going to lead towards benefits and outcomes. In crossing that chasm, or filling it in, so however we may, has your research explored tying the use of wearables and devices to, along with a specific medication, meaning that the device use is provided in concert with a drug or another therapy, so that then could be brought into an entire treatment regimen, and in that way it can address some of the patient needs, and perhaps that the market is not particularly looking at. Have you explored that, or if not, what do you think of the idea?
Yeah, so thank you for the question. The way in which I've explored it, I have a friend who's a geriatric psychiatrist, and one of the things that he is going to be doing is taking some of our trackers and giving them to his patients when he's giving them new medications, because he said that his what he tracks is how they're impacting their mental health. And what he would like to use the trackers for is to look for all the side effects. How is it, are people becoming increasingly sedentary? People having sleep problems? And, kind of the wealth of side effects which can prevent a medication from being successful, or even prevent somebody from adhering to their medication. So that's one of the ways we're looking at it. And I think there's just so much potential. One of the N of 1 studies that we've done was somebody who was hospitalized and then was in a rehabilitation center. And, so it's a very different way of encouraging exercise, but walking from your bed to the end of the hall and back one day and then doing it twice the next day, that was all an important part of her recovery. And the tracker was really useful in helping with that. So I think there's just so much potential with that. And the idea of, like I mentioned Tracker Lending Library, which was the idea of physicians being able to prescribe a tracker to a patient for use until their follow-up visit. And to do that in concert with a new prescription is something that would just make so much sense. So I love the idea, and that might be my next research project.
That's great. Larry, question?
Hi, Larry Smith. And question for you, 2 questions. Think about a physician who's caring for a patient. Think about a physician who's caring for a patient who may need assistance at home. Does it make a difference in terms of success at home whether the person has sons or daughters? Mm-hmm. And does it make a difference in how far the child lives from the home?
I don't know that I know of any research that's asked that specific question. That's a good question. But we do have some research around what a difference it makes when the family member has support. So there have been 2 studies, one of which I did, one of which was done by a friend of mine, Tamara Konecka at the University of Chicago. And the one that I did was with an organization that provides nurse practitioner support to the family caregiver 24/7. So there's that the family caregiver is really integrated onto a medical team and provided with medical sort of support. So the idea is to sort of start to reduce the amount of times that emergency room visit happens and the ambulance is called, and to provide them with some monetary support. And we did see a reduction in hospital use that we think was significant relative to the benchmark, and sort of same in the other study, which was those caregivers were provided with some monetary support. The family caregivers were. Just more support for the family helps them do their job better and creates better outcomes. So I don't know that just a daughter or a son, but it's when they're integrated, and if that makes sense.
Great. So maybe we'll, I don't know if I should go to the mic versus I don't know what to choose. I'll go to the mic and come back. Is that okay? Okay. We'll take your question.
So just a follow-up comment and then sort of a question. Shauna Koss from the first panel. Thank you both for interesting things. So there are some resources on the services uniquely in DC and San Francisco from Washington Consumer Checkbook. If you're not familiar, they actually do providers rating providers, and then they also do an Angies List kind of thing for a number of healthcare things. And full disclosure, that was my first job out of college, but it's a long time ago. And then one of the things we haven't talked about, although Ann touched on, and I'd like both of your reactions and hopefully the reflections panel, is unfortunately, elder abuse happens more often by the family than anywhere else. And it's very insidious, and the more isolated and fearful an individual is, then the more easily they can be abused emotionally, let alone financially and physically, etc. And I'm a true believer in ideally the individual stating their preferences, even if those preferences have some safety risks, but the tensions and how that gets resolved, and unfortunately it often falls to the legal system if there's serious problems. So how do we take that into account, and have we seen any examples of how that works better? Maybe Nora can figure it out.
Yeah, I'll let Nora answer. I see it right there. Did you want to say anything about that? This time, okay. Lisa, okay, it's me. I don't really know. I mean, I don't have great ideas for how to avoid the legal system when you get into that situation. I think what we have to do is a much better job of educating. I mean, this is easier said than done, but it's just so important for individuals to set up their wishes and make them clearly known and really think through the ramifications, kind of in advance of being in a dire situation. And so when decisions are made, this person will take care of this person and that's that. It sets them up essentially, to not really have any other choices after that. And so we have to make, one of the things that people will say to me sometimes, they'll say, how can I prevent myself from being a burden on my kids? And I'll always say, tell them what you want now. Like, give them permission now to take away your keys, or give them permission now. Talk about your difficult sibling. What happens if, I don't mean to make a joke out of it, but my sister put her dog on a pacemaker, her 18-year-old dog on a pacemaker. And is this being recorded?
Yes.
Hi, Kathy. She's in public health. So anyway, so I said to my parents, you should think long and hard about which one of us is making the decisions about your health care when you can't. So, these are conversations that the sooner you can have them with each other in as honest a setting as possible, the less you're going to be running into situations where you've lost control of a loved one's care.
Great. Lindsay, I'll come to you. We'll come to the mic.
Shut everybody up.
It is now.
Got it. Thank you. I should know. I've been here, 4 years? I should know that. So I have the honor and privilege of being one of the two dentists on the round table. And so I'm speaking from my oral health perspective. And we know a lot of the medications that older Americans are on significantly can impact oral health. I mean, dry mouth. And if folks are undergoing chemotherapy, there are medications that can impact the oral health. And what do you have families and caregivers that are cognizant of those relationships between oral health and the medication they're taking? Is it recognized? Because it seems like, from my perspective, it's often missed. And in fact, my mother, who was diagnosed with a chronic pulmonary condition, was on long-term steroids, and she ended up having burning mouth, and she had a candidal infection. And that was not really recognized until she wasn't living with me at the time, until she went in to see her dentist, and and said, there's something going on here, you know. So I'm curious to know if that linkage is well known, and also if you have a number of caregivers who are having difficulty finding a dental home or finding dental care for their loved one, and having a hard time finding one, and what the impact has been on their lives, and how are they able to find funding for that, because as we know, that's a huge issue. Dental care, Medicaid, most states do not have an adult dental benefit. There's no dental benefit in Medicare, so that leaves older people high and dry in many cases.
Yeah, it's actually a really big issue. So I don't think there's any awareness. Understanding the ramifications of medications just generally is not something that caregivers feel like they have a real good command over. I mean, they feel, so in fact, one person said to me, I was saying this to one of you, I can't believe I'm in charge of all of this. This is a lot. I mean, it's a lot to be able to know. So they definitely, I've never heard anybody sort of remark about that connection. But I've definitely heard a lot of suffering among the caregivers around the dental care of their parents, because it's, when you have a parent who has a dental issue, it's, they're in agony, you're in agony. And at least one or two have said to me, I don't understand why Medicare doesn't cover this. I have no way, they'll send me a note like, my mom's in assisted living and I can't get her to a dentist, and now we don't, I don't think we have coverage for this. And so there's a lot of stress around dental care for frail older adults, without question, among the family members. But unfortunately, I don't think that they're making the connection with the medications, at least as far as I can tell. So that'd be a great place to do some education.
Great. Come here.
Hi, Nora Super with M4A. First, I'll just address Shannon's question about elder abuse a little bit, sorry, which isn't what the question I was going to raise, but I just, as you know, it is rampant and most often is from a family caregiver. Two things I've mentioned is there are technology solutions that are trying to help address some of these, especially in financial exploitation of checking, people, you can get arrangements with your bank, a sibling that may not trust another sibling kind of thing, to make sure if there was an unusual withdrawal or transfer of funds or things like that, to at least help with that. But I think the broader issue is that most of the abuse relates to some sort of economic needs or lack of education or other societal needs that need to be addressed. And just one example I'll give that I think is important for this community is in the Post a year or two ago, they had a case of a woman who, Adult Protective Services came to get her because she had been abused by her son. She, had stayed, had horrible bed sores, hadn't been moved, had the same socks on for months. Well, the man was, illiterate. No one told him how to care for someone, that you're supposed to turn them and everything. I don't think, in this instance that he meant to abuse his mother. He just simply didn't have the skills or what he needed to care for her. And as Ann said, it can be horribly stressful to take care of people, especially, that need round-the-clock care. So there's also just the supportive services, again, that I think would help reduce elder abuse. But on a more positive note, my question was more for Lisa. One of the programs that we run at M4A is a new National Resource Center for Engaging Older Adults. And we have some fabulous partners that we focus on. The grant required focus on creativity and arts, technology, generational issues in lifelong learning, all for $125,000 a year. You all know, how this goes. But anyway, we bring together these fabulous partners that we have who are all dedicated. And I just wanted to make sure you didn't mention, I'm sure you're aware of the older adults technology services in New York City. For those of you who don't know them, they're a great group. They run something called Senior Planet, which my daughter actually, my 23-year-old daughter is a trainer, and older adults go there to help get training on using devices. So she teaches a class on how to use your iPad. And so people bring in their iPads and they walk through, and it's really hands-on. They love it. But they also do things like how to use a treadmill. Sometimes, older adults want to exercise, but they get to a gym and it's overwhelming because it's all digital. They don't even know how to turn on the machines, and much less, to get on it. So it's just very practical information. So I just wanted to ask Lisa if, what research you've looked at or studies in terms of that. You mentioned the manuals and all this stuff, although a lot of times I find manuals to be not helpful, usually written by someone who doesn't speak English. And so I'm just wondering, if you've done or seen research that looks at, hands-on training and that benefit for older adults in technology.
So it's really nice that there have been a lot of programs that have started, many of them through senior centers, community centers, and so on, to really help people get this kind of digital literacy that I was referring to. And I think that that's great for sort of the basic devices, but I think that there's also an assumption in how the devices are packaged and sold that they should be easy to use. And so that you don't buy an iPhone and expect to have to go to a class. So, people think that they can do it on their own, and then they're not able to, and then they rely on others to help them, and then they don't really learn how to do it themselves. Somebody's just setting it up for them. If you've ever gone into an Apple store and looked at the average age of the people working at the Genius Bar, they're not necessarily going to have the skills and the patience and and the understanding of how to help somebody, not just with setting something up, but with using it on a daily basis and answering their questions and helping people with misconceptions. And that's where I think the very high touch, hands-on approach that I've taken. People don't have to stand in Best Buy and look at this aisle full of devices and say, which vendor, which model, which price point, and is this going to actually help me? But we're giving them the devices for free. We're walking them through the process. We're helping them configure them to what they believe that they're capable of doing. And then we're also showing them how to change all the settings. And they don't walk away until they have that level of comfort. And I think it's, that's where there's kind of a gap between the kind of classes which require somebody to seek it out, to say, I need help with this, to is this a device that's going to help me? And how am I going to use this? And, I think your example of treadmills is a great one, because if you walk into a health club and you're not even sure, how do I turn this on and how do I adjust this? And is it going to be going too fast? And, it's a real barrier to use. And I think, that's part of what our process has been, really identifying these barriers to use and saying, what's going to make it possible and easy and comfortable for people to take advantage of these devices that are out there. And I've just been talking about trackers in my research, but there's really kind of this whole broader field of apps, and and sometimes we'll talk to people just informally about, especially because we have their phones, which apps do you use? Do you find them helpful? And what I often hear from people is, oh, my doctor said there's this thing, My Fitness Buddy, or no, it's My Fitness Pal, or, well, I don't really remember the name, but, I downloaded it, but then I couldn't even get past the first step. So, again, it's kind of that high touch. With one of the things that we are doing with Tracker Lending Library is that when the physician prescribes the tracker, that the person is going to the front desk and the medical assistant or the front desk staff is actually helping them set it up. And, I think that it's really kind of that high touch that's so necessary. So the classes are great, but the classes are really addressing, kind of the basic internet use. They're not really addressing the app use and the device use. that I think is so important and potentially so helpful for older adults.
Thanks. Marianne, I have Marianne, and then I have Nicole next. Back there.
Thanks. I promised I would make a comment or ask a question. With this past discussion, I just want to say one thing that we have tried that is in between of how do you learn to use things. Our village has an informal program once every 2 weeks, same time at the local rec center or senior center. And it is us helping ourselves. And it does not deal, I guess, with Apple products. I've not gone yet, but I've heard people that do go. There are people that use Apple products, but they've chosen, instead of going 2 different systems and losing everybody. But if you have Android anything, come in and say, hey, I don't know how to do such and such. Well, I found out this way. So it's in between somebody that knows and goes too fast and somebody that doesn't know, and it appears to really work. Now, the question about sort of tracker stuff, since I said I get tired of technology, a thing that I was thinking of with the trackers, because I have some relatives that use them, is I'm left-handed, and I don't want to, well, 2 things. I don't want to add anything more to my wrist. So if it's a watch, I could get rid of my watch. But everything is one side or the other of the watch. What I've found is most things are made for right-handed people. I'm supposed to be able to pull out little things. I don't have any touch left in my fingers. So I couldn't use, now I've not tried a tracker, but I couldn't use anything that requires me to do much pushing, pulling, because I can't do it for 2 reasons. Often because it's for a right-handed person to maneuver, and because I just don't have the dexterity. So I don't know what you know about that, if you've seen that.
All of the brands that I've used work equally well for somebody who's left or right-handed, and some people actually want to stick with their watch because they like it, because it has sentimental value, and so I'll see people wearing the tracker, wearing their watch. Whatever works for people. It doesn't necessarily have to be a substitute, one thing only on your wrist. But in terms of, kind of the issues around touch and what the one that I'm using, and I'll come over and I'll show it to you. It looks like a watch, and the dial isn't even giving me the exact step count, because I really don't care if I've walked 2,321 steps today. I just care, how am I doing at achieving my goal? And I just want to glance at it. And so I don't have to be touching anything. I don't have to be pushing anything. And at one point, I was actually wearing a Fitbit and a watch, because as an academic, I'd have a student sitting across from me, and I don't want to, push a button to find out what time it is. I just want to be able to glance at my wrist and see, oh, we've got 5 minutes left. Let's make sure we get to your important questions. But these form factors are things that are really, really important. And when I wore, basically I would have a watch, a Fitbit, and a hair elastic on my wrist every day. And I thought it was really stupid looking. So I was actually happy to pare down to one device that I can look at and it tells me the time, and a hair elastic. But your point is a good one, that, dexterity being, like, what do you have to do in order to be able to use it? Because for so much of this information, it's really something that you want to glance at. It's not something that you need extraordinarily detailed information like you can get from the app. And if I can just actually expand on that, one of the things that we've also discovered is that with using the apps, you get these sets of messages, which I find so extraordinarily unhelpful for the people in our studies, that for most of them, I actually suggest that they opt out of these messages. So like I get messages like, congratulations, Lisa, you've gone the circumference of Lake Como. And I think, is that motivating? But a lot of these messages like, oh, you're invited to join a challenge, or it's National Such and Such Week, and it's a lot of this is really not designed thinking about how is this going to help and motivate and support people in achieving their health goals. So it's really, part and parcel of a larger issue. And thank you, because that was really a great question.
Nicole?
Hi, my question's for Lisa. Nicole Holland from Tufts School of Dental Medicine and former student of Dr. Gualtieri. So my question is really about trust. It was brought up earlier in Dr. Thomas's talk, but just trust in the system and however we're defining system, but specifically here with big data and tracking health information. So specifically the tracking devices and the tracking apps of what could potentially be personal health information. Is trust in that system of keeping it secure and what's going to happen with my information? Do you find that to be a barrier with this particular population?
In many of our initial studies, we asked people, are you concerned about the privacy of your information? And as we would walk people through setup, we would also talk to them about that. And we got the exact same response from almost everybody, which is, given credit card breaches, given, whatever the latest massive breach in the news was, if somebody has access to my height, weight, and how many steps I walk today, I don't really care. So, I would explain to people there's actually additional information that people could have access to. But what we find is that I think people are really numb to some of the privacy issues that they actually should be concerned about. And perhaps the trust is greater that this will be protected than it should be. One of the, speaking of trust, there have been a lot of studies looking at trust in the healthcare system, and that people's trust of their physician is very, very, trust of physicians and pharmacists, sorry, not dentists, is incredibly high. And that's one of the things that, not our initial motivation, but one of the things that's really motivated us to continue in this work with integration of tracker data into care, because physicians are the ones who have that broad picture of somebody's health and who have that trusting relationship with their patients. And so therefore are the ones who know what medications they're on, who know that they're pre-diabetic, who know that they had a fall a couple of years ago, but they've recovered, and really are the ones who are best able to give them advice about safely increasing their physical activity. So it's, it really motivates us to want to do that and to also figure out how to bypass the biggest impediment on the part of physicians, which is lack of time.
Okay, Alicia?
Thank you for your talks. I'm Alicia Fernandez. I'm a member of the Roundtable, and I take care of patients in San Francisco, which are very low income, usually immigrants, and tried for a while, I would argue misguidedly, to get my patients to be able to use their automatically loaded fitness app to look at their steps. And I think I want to make 3 points and see what both of you react. One of them is that I do believe that that market failures exist. So some 6-7 years ago, I wanted to buy my mother, who was having mild cognitive impairment, or not so mild at that point, a phone that was just an easy phone. I would have been willing to pay twice what my smartphone costs in order to get her the right phone, and it didn't exist. My understanding is that now there are some phones that do work and that the market has caught up. But let's say that, but it is amazing how much the market can lag what is behind really a very large potential market. Second is the issue, I think they are market failures. I also think that the issue of who pays is the key one here. Rideshare services are now starting to bill Medicaid for ride shares. And within that, there's grown up a parallel system. For example, a service called GoGo Grandparent, where you can, as an adult living far away, have your elderly parent pick up the phone and then and talk to someone, and that person then will call a rideshare service with all the information preloaded. And we're putting people back in to the intersection between the ultimate consumer and the technology. And I think that is perhaps the right way to go, rather than trying to train every individual to be able to do these things. And because of that, I think that your work on trying to train people is very moving to hear you speak about this, and I really salute you. I wonder, though, whether we should be doing that, or whether the energy that you, and for that matter I, spent on that might not have been better spent saying, you need a walking partner. And that walking partner could be wearing the Fitbit or whatever, or not, because it really actually matters that they walk, not that we know how much that is. So just a few thoughts, and I hope you take them in the spirit in which they're intended.
I absolutely do, and no, thank you so much. So if I can address your 3 points, the first one in terms of market failures, and I think that there's so many forces at work, and many of them are completely beyond me, because I think they're products that are great and then they disappear, and ones that I don't think are so great that are dominating our lives for better or for worse. But certainly there have been smartphones that have been designed in this very simplistic way, and I think that I just hope that they're being well marketed and tested with the intended population, that it's not like the picture I showed of the big red button hanging around your chest. But to really understand what are the functions that people need and how do you make it easy for people to use them, I think is really important. Your second question about who pays, you're touching on a nerve with me, because we're giving out trackers to people for free, and we've been lucky enough to have generous donations of last year's models, or I guess a lot of the ones that we've got they're called buyer's remorse, that people decide they wanted a different color, but they can't resell it, so they've been giving them to us. So we've been really fortunate that we're giving, for most of our studies, we're giving people brand new trackers, and people are really excited to get that. But kind of the bigger picture, a lot of insurance companies are looking at this, and of course it's a cost-benefit model. If you can give someone a tracker, and overall it's going to increase people's health, decrease hospitalization, doctor's bills, et cetera, it's a worthwhile expenditure. But some of the research that I've done, one of the studies I didn't talk about was understanding the failure of a corporate wellness program, and it was really kind of fascinating to delve into it, and it really brought up things like trans-theoretical model of change, and how. And if you take people who don't necessarily care about devices, and you just hand them to them, what happens? And that's what a lot of corporate wellness models are doing, and then bringing up the kinds of privacy issues that Nicole was talking about, the trust issues. What do I want my employer to know about me? Do I really want them to know how many hours I slept last night and whether I did take a walk or not? And, so who pays does become a real issue. And I think that the problem has been that when people are paying for this, it's often just paying and tossing it to them, as opposed to really thinking about how do you integrate this into people's lives, and what kind of training do people need to use something like this successfully. So, I think there are more bridges to cross there. And then finally, your point about walking partners. I actually was just on a review committee and sort of rejected, I'm sorry to say, a proposal that had to do with community-based walking programs. And the reason for it is that I felt like they really weren't looking at some of the issues that we've seen. And so working within senior centers, we see people who know each other well, or, they're kind of friends. And like we've even seen walking groups sort of spring up organically. And I think the problem becomes, how can you help orchestrate that? And in a sense, you really need people who like each other and have something to talk about, because that's really motivating and it makes it fun instead of just exercise. You need people who have similar schedules, and you need people who walk at similar paces for something like this to work well. But the social support around that is so powerful. And one of the things that we were starting to promote a little bit in one of our senior centers was because there's so many people who don't walk when the weather is bad. And we were discovering that there was a lot of ride sharing going on, because there were only a small number of people who owned cars in this particular community. So could you encourage people on the days when the weather is bad to actually drive to the local mall together? And I was even suggesting to people like these little challenges, like to go to the grocery store and to actually walk up and down every aisle, whether you need to go on that aisle or not. But just, kind of small ways that you could increase your steps, but also to do it in a more fun and social way. So I think you're on to something. I think there's a lot of potential there. And it's something that I'd love to explore more, because I think it just increases people's accountability and it makes it fun.
So thank you. I think we'll have to end there. Many thanks to Ann and Lisa.